Okay, welcome to part 2 in the marketing program. Now we're going to be dealing with this thing we call it evaluate. Again, to kind of go over the 3 different parts again, we just covered the attract part. Now we're at the evaluate. We're going to talk about experience after this one. But right now we're in this thing we call it the evaluate stage. So now you have this individual and they're going to be coming into your office. They might be even considering your office. And along the way, they're going to be evaluating to see if this is something they want to move forward with. And so everyone has kind of in their mind their own little checklist of things that they are wanting. And we'll talk about this in this case is a specific dental office. They're going to want something that they're looking for. Okay, they have a certain criteria mix, and everybody's a little bit different. But there's a lot of similarities between people, but if you can try to get as many check marks, meaning things that they say yes, you can line those all up. If you hit all their check marks, then yes, they are somebody who is ready to buy, ready to move forward with getting treatment done. You may have someone who comes in though that kind of likes what you have going on, but they still have a couple of lingering questions. They're a maybe, okay? They're not there yet. The reason why the word yet is in there because if you can work a good dialogue with them, then that will be possibly a way to move them forward. And there's others that come in where they still might like a few things, but there's just something about your practice that they consider a deal breaker, okay? Something that they're just not willing to move forward with. And so, yeah, that could be marked as a no. That could be a deal breaker, possibly. The reason I say possibly is that people can be moved along this way. So the question is how do you move from a no to a maybe and from a maybe to a yes? How do you move them? Answer: be curious and know your product. Those two things. If you can be curious about your customer, what are the questions that they have, or why is this thing considered in their mind a deal breaker? Know what that, be curious about that. And then of course, know your product so you can maybe answer those questions with some credibility so they can feel like they're in the, in right hands. So let's go to what that curiosity part is. Curiosity is something like this. Patient says something or issues a concern, an objection. You can respond by something like, tell me more about that. And then they'll tell you more about that. And you can see if it's something you can work with. Or you might say, oh, really? Well, why do you think that is? Or they say something bad happened, to them at a previous office on a similar procedure. You can say, oh, did that happen before? Or have them talk more about it. Or if they're saying something, you just say, well, then what? And then have them keep telling the story. Because when you finally kind of get this story out of them, now you better understand who your patient is. Second part is then, of course, know your product. You got to know the features and the benefits. You know what it can do, what it can't do, what's the right sequence that you'd have to do to make this thing happen, the logistics, and what kind of wiggle room you have when trying to get this put together. As you know, in dentistry, we work with treatment plans, and there's many different moving parts with it. And sometimes you can rearrange things that will make it more palatable for the patient to move forward with it. And so if you found out what it is that's on their mind, and you know your product, you can see there's a better chance that you can move someone from a no to a maybe and from a maybe to a yes. And so again, same thing, you're going to move them to a yes. Now, when you think you've solved the problem, so they've issued a concern, you were curious, you got more information from them, you then took what you know about dentistry, know what's possible, you put those two things together, it looks like it's a workable solution. Let's just confirm this, with the patient by saying something like, does that sound good, or will that work for you, or will that be okay, or does that make sense? Now you're going to have a way of kind of moving forward in the conversation. If you don't address those things, if you don't kind of confirm that you kind of are on the same page with the patient, then it's going to be very difficult for them to move forward. They're going to kind of be in pause mode until they decide that, okay, their issue has been resolved. Not manipulated, just they got their question answered. They had a question, you got it out of them, a concern, you got it out of them, and now you know what you can do, and you've tried to create a fix that's going to be workable for both of you. Now, here's some mistakes, though, when you're trying to move along the way to a yes, okay, is assuming that nothing can be done about what the customer's thought is. Okay, if you just think, well, that's it, there's nothing that can be done. If you don't take the time to be curious, if you don't know what you're doing as far as you don't know your product knowledge, or you just are frustrated with the situation, it's easy to just say there's nothing can be done, throw up your hands, and of course nothing's going to happen there. Or if you argue or disagree with the customer, obviously that's not going to work either. Sometimes patients come in and they have a very different understanding of how things really work. And it's going to take you with some patience to help guide them through to kind of get to where you need to be. If you don't have that, it's going to be very difficult for a patient to feel comfortable. So think of it this way. You are trying to be the patient's guide. Again, I'm going to say it over again. Once you know what their concern is, you're curious, you pull that out of them so you kind of get them to talk, and you know what you're doing, you can put those two things together. Think of yourself as a guide. I know when we talk about this whole idea of sales or being a salesperson, that kind of has a negative connotation for some people. So maybe instead of think of it as that, think of yourself as being the patient's guide. You're kind of being their advocate in a sense. They're coming in with a concern. We have a way of fixing their concerns. Let's put the two things together. If it's a good fit, by all means, you should be a guide and help move them forward. Okay, that wraps up this video. The next one is going to be on that third part called experience.